it contains, and it contains 100% B2, right? And so, I mean, listen, let me just introduce myself here for so far, because some of you may not know who I am. So my name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. I'm the longest serving IC support group leader in the United States at 27 years and counting. Makes me one of the top in the world too, to be quite honest. I think there might be, I think the German group is, I think they started the year before I started. So almost the oldest in the world. There you go. I bring to you 3 college degrees. I have 2 degrees in chemistry. I have a degree in inorganic chemistry. I have a degree in pharmacology, drug development, and then I have a master's degree in psychology. I decided to step away from drug development because I love animals. I could not tolerate the animal research. I changed direction, turned in my federal pension, went back to grad school, got a master's degree in psychology, was on my way for a PhD in psychology when what the hell happened? Hello, IC. That also happened to Bev Lauman, author of A Taste of the Good Life, a cookbook for the IC diet. She was the support group leader for Orange County, California. And, I continue to think that the single most brilliant, smart IC patient in the world is Beverly Lauman. She was on her way for a PhD in another type of chemistry. And the woman is simply brilliant. It's amazing how good she is. Anyway, the IC Network was my doctoral dissertation proposal, icnetwork.org. And I'm very happy to say that for the last 20 plus years, we have been rated #1 in the world by Harvard Medical School and the University of London. If you haven't heard of Interstitial Cystitis Network before, that's probably because you're familiar with the Interstitial Cystitis Association. And that's how I got started. I was a support group leader for them for 2 years. But then I got really interested in bringing support to patients who were homebound. They were not interested in that. I was interested in that. I wanted to get my doctorate. And I found a dissertation at Stanford on how to bring support to people who were confined to their home. And the rest is history. So I modeled the IC Network after that doctoral dissertation. And there we go. We have 3 jobs at the IC Network. Number 1, obviously, we're patients. I'm a patient just like you. My number 1 job is to work with you. Yes, every single one of you. When you have a question, I am your advocate. I want to be your advocate. I want to provide you good quality information to make you stronger and more empowered and more informed, so that when you walk into a doctor's office, you will be able to have a good, frank, honest discussion about your medical care. Listen, my friends, I do not want you to walk into your doctor's office and start crying. That does not help. That does not help at all. I want you to be able to walk into your doctor's office ready to kick some ass, because we're not taking IC out of a textbook anymore. 10 years ago, 15 years ago, you had frequency urgency. A doctor said, yeah, you got interstitial cystitis. They threw Elmeron at you and they kicked you out the door. Or, if you were lucky, you might have gotten, and I'm saying that incredibly sarcastically, you might have gotten DMSO. Maybe heparin installations. And heparin, thank God for heparin installations, most popular therapy around the United States, around the world, because it's called a rescue installation, because it's the first therapy that can turn pain off, which is a good thing. But we now know that there's tremendous diversity in this IC patient population. We no longer think of this as an incurable bladder disease. And we haven't for a decade. It is a pelvic pain syndrome, my friends. It is a pelvic pain syndrome. Why? Because structures outside of the bladder are usually also involved, usually your muscles and or nerves. All right. So my job number 1 is to educate you and to take your questions and give you, good inspirational, motivational talk. Listen, if you are dealing with somebody who is disrespecting you, who is demeaning you, who is telling you that there's no other option, or you just need a pep talk before a doctor's appointment, and you need a list of questions that you're going to be asking that doctor, I'm your girl. I can give a mean pep talk, and quite a few of you know that because I've talked to quite a few of you. The second job that I have is I'm your advocate. The way that I'm your advocate is I serve on research panels because I bring the interests of the IC patients to the research community. So I was on the US Army research panel for a decade. Um, I also am kind of your frontline defense when it comes to consumer issues. So we are the ones who broke the Elmeron eye story, the Elmeron eye damage story, because you deserve the right to know that. This is called informed consent. If there's a problem with a therapy, you need to know what that potential problem is so that you can look out for it. So as an example, so we all know that Elmeron now in the last year and a half, actually 2 years now, has been linked to retinal disease. And it's just become, devastating to so many patients. We have our first lawsuit filed in the US District Court in Connecticut. The conservative studies at best show 20% of IC patients using Elmeron show changes to their retina. Our own survey shows 54% potentially. And so anyway, I want to be kind of the consumer advocate. And it's interesting. Puts me in a difficult position sometimes. Some doctors, when I talk about bad things, might not appreciate that so much. But hey, man, I'm on your side. But I do have to help the research community. So we do a lot of research studies through the IC network. If you're on our newsletter list, you see that we send out fairly consistently throughout the year invitations to to participate in research studies. That's important because without your knowledge, how are we going to make progress? I mean, I can remember telling my doctor when I was first diagnosed with IC, I said, "Doctor, here's the way it happens with me. I have one day of vaginal pain, pretty bad. One day of urethral pain, pretty bad. And then finally, my bladder pain turned on." And my doctor would just my urologist would go, "What?" Like, "What? I have no idea, Jill. That's so weird." My OBGYN was like going, "Jill, that's crazy." And it's like, "Oh, no, now we know that. Now we know why. Now we know that the basis of that could be muscle tension, could have been a pelvic floor flare, could have been shared nerves. It doesn't happen anymore, but we have wisdom to share. There's tremendous wisdom in this IC patient population, and it would behoove the powers that be to listen to us every now and then. All right." So normally I do kind of a 30-minute lecture ahead of time. I really don't have anything prepared today. I thought I would just riff and see what you guys have going. And so let's just go ahead and take your questions. And yes, this time I have eaten. I usually don't eat before these. I almost dislocated my jaw 2 nights ago sleeping. So I had to sleep in the recliner last night with a muscle relaxant because the way I'm showing the stress is tremendous tension right here. Oh, like holy moly. All right, so let's do your questions. Now, just so you know, YouTube, I can scroll back and see your questions. Facebook, I can't. And so Facebook, if I miss your question, please don't take it personally. Please ask it again. So let me just move my computer around here. Okay. YouTube. Facebook is up here. YouTube is down there. We should all be doing this on Twitch, by the way. All right. Hello, Rebecca. Jamie says no flickers. Hallelujah. Thank you. I just got these. You like my earrings? DJ said, had an installation this week, sent me into a flare. I don't know when I will be able to have my hydrodistension. So, okay, all right. So, DJ, it would be interesting to know what kind of installation you had. Was it a DMSO installation? Was it a heparin installation? You guys, not all installations are the same. And seriously, I'm stunned at the number of people who call us for coaching, who call me for coaching, And when I ask them what therapies they've done, they go, all of them. And I say, well, be specific. What have you done? They go, well, bladder installations. Like, okay, well, what kind of bladder installations? And they're like, I don't know. Like, guys, you can't do that. You cannot do that. You have to start tracking by name all the therapies that you do, all of them. And if you go over to the IC Network website to our free download area, we have a medical records kit you can download where you can actually track your treatments. You can't just walk in and say, I mean, I have to be really, really honest here. Anytime somebody calls me and says they've done everything, I know for a fact they haven't even done half of what they need to do. And when I start going through the therapies and the subtypes, and I go, did you do this? They're like, no. Did you do this? No. Did you do this? No. Okay, you haven't done everything. The cool thing is that now that we have subtyping, now that we understand the variations of IC, you can have a treatment that is specific to you, that will target your issue. You know, who was I talking to? Oh, yeah, I was talking to one of the attorneys that filed the Elmeron eye case in Connecticut on Friday. And I said to her, I said, you know, the really sad thing is that back when Elmeron was invented, you know, and released in 96, and we didn't know about subtyping, thousands of patients were put on Elmeron that we now know never had a bladder wall issue. Their issue was being driven by their pelvic floor. And in many cases, patients just kept taking it, even if it wasn't helping. I was talking with another patient who'd been taking it for years. And I said, is it helping? They go, I don't know. I said, well, have you stopped it? And they went, no, I don't want to stop it. And it's like, but you don't know if it's working. You don't want to keep doing a therapy if it's not working. So how do we know if Elmeron's working? According to Dr. Parsons, when he was asked this question in a support group meeting on our website, when he was in our free lecture series, what he said is, somebody asked him, do I have to take Elmeron for the rest of my life? And he said, no, absolutely not. We just have to figure out if it's helping you. So how do we do that? He said, reduce the dose. You're taking 4 a day. He said, go to 3 a day for a week. If your symptoms don't get worse, okay, go to 2 a day for a week. And if your symptoms get worse, then yeah, okay, then we know that coating effect would be helpful, which means you're probably IC subtype 2 bladder wall driven or estrogen atrophy. But if at 2 pills your symptoms don't get worse, then maybe it's not working. Go to 1 a day for a week and slowly work your way off. And if your symptoms do not change as you reduce the dose, you are done with that medication. That means the medication is either done its job, or more importantly, it's just not effective. Oh, this Facebook screen is driving me crazy. It's flickering in my eyes. You know what? I'm going to do is I'm going to actually cover here. I'm just going to cover that screen up. Yeah, that'll work. Then I don't have to see this flickering. It's going to make me crazy. Ooh, better. All right. I just need to get that under there. All right. I need to move that here. Sorry, guys. All right. Angela says, any ideas for pain? All right. Let's get to it. So concept number 1 is before we can talk about therapies, we have to talk about what is possibly causing your pain, right? There are several. So you got to understand that the pelvis is a very small area. Think about it. It's like at best 8 inches tall, your width and depth. And your pelvis is your anchor for the human body. It is what carries the weight of your torso. It deflects the stresses and the forces that are coming up your legs when you walk or jump or stumble. And in this small confined area, it's also a communication pathway. So the nerves that go from your brain down your spinal cord to your legs go right through your pelvis. The blood vessels from your heart and your lungs go right through your pelvis. And so it is a small but mighty portion of the body where there are so many things close together that it's very hard to distinguish where that pain is coming from. It can come from an organ like your bladder, or if you're a woman, your vagina, your ovaries, your uterus. Could come from your kidneys if you're having low back pain. Oh, that's not in your pelvis. It's a little bit higher. It's far more likely that it's coming from muscles, tight muscles, or it could be coming from nerves. And so how do we distinguish these different types of pain? Concept number one is, so this is what I always ask patients. So number one, when is your pain the worst? Before you pee or after you're done peeing? If your pain is worse as your bladder fills with urine and it is relieved by urination, then we know that's your bladder wall. If your pain is worse after urination, we know that's your pelvic floor, all right? Or that's something other than the bladder, usually the pelvic floor that's triggering that. Bladder wall pain is very sharp and shrill. If, it's described as ground glass, razor blades. And that's how mine was when mine started. It's like, it's so freaky that you're actually up in the middle of the night, you got your hands over your belly and you're going, oh my God, what the hell am I feeling? People are not normally meant to feel pain in the bladder wall. In fact, the pain nerves in the bladder are remarkably hard to turn on. It takes some sort of trauma to turn them on. They're called C fibers. Okay, so concept number one is before versus after. Concept number two is the quality of the pain. Is it sharp or dull? Is it electrical? Is it ground glass? Your ability to describe your pain is pivotal here in helping your doctor understand what could be happening. And then we got to deal with location. You got to be able to say, where is the pain located? Is it to the left? Is it to the right? Is it in the center? Is it low? Is it high? So anything that is to the left or right of center is not your bladder. That's your pelvic floor or nerve. If it's low, right behind your pubic hair, okay, now kind of in that area, then we can talk the bladder. If it's higher, like below your belly button, we're going back to muscle. And also, some patients will often just say, well, it just hurts down there. And it's like, no, that's not good enough. You can't just say it hurts down there, my friends. You got to say where. Is it outside of your body? Can you touch it with your finger? Is it inside of your body? Is it your urethra? Or is it deeper in your body into your bladder? I will tell you that a lot of women that I have worked with have pain in their urethra, and as they urinate, as that urine is crossing their vulva, it feels very hot. And that is actually usually estrogen atrophy. It's usually an older woman or a woman who's had a hysterectomy. Their estrogen levels have dropped significantly. And as a result, the nice thick coating of mucus that protects the urethra and the bladder and the vulva gets thinner and drier. So the urethra is kind of like the canary in the coal mine when it comes to estrogen levels. If your urethra is starting to scream, here, hold on, I gotta adjust this. I'm seeing this flickering out of the corner of my eyes. All right. If your urethra is screaming at you, again, that's the canary in the coal mine. That's usually the first part of the urinary tract to react to the loss of estrogen. Okay. And so if you've got pain on your vulva outside of your body, that is not IC. That is not, although we used to call it IC on the outside. What we now know is that is really estrogen atrophy of the tissue. And because that tissue cannot defend itself from urine, when urine crosses it, it hurts. For guys, now let's talk about guys, because, first of all, a ton of men have this. We now think the vast majority of men diagnosed with chronic prostatitis actually have interstitial cystitis, or actually the correct word is urologic chronic pelvic pain syndrome or chronic pelvic pain. Men are interesting because you guys have some really interesting nerve kind of referral pathways. And so quite a few men struggle with pain at the tip of their penis. Um, Another really interesting way to distinguish between men and women is around the whole area of intimacy. Because for a woman, usually sex is comfortable, unless of course you got really tight muscles. But usually the act of intimacy is fairly comfortable, and your flare doesn't begin until about 8 hours later, 4 hours later, because that's when a series of muscle spasms happen. Women, after orgasm, we will have muscle spasms for 24 to 48 hours, which I think is just to help sperm meet egg. I think that's just a biological imperative. Whereas a man with IC or with pelvic pain, they will have their worst pain at the moment they ejaculate, because that is, in fact, when the strongest pelvic floor muscles spasm occurs. And again, for the vast majority of men that we work with, that I have worked with, usually what we find is a pelvic injury of some type, usually a pelvic muscle injury. If you have jammed your crotch on the bar of a bicycle, for men or women, or you have fallen on your tailbone, or if you're a hockey player or an ice skater or a football player or a paratrooper, something that involved repetitive falls to your pelvis, those pelvic floor muscles will end up damaged. And if the urethral diaphragm muscles are tight, it causes frequency, urgency, pain, all sorts of things. Curtis says, you looked over a CAT scan from 12 years ago. It says bladder wall thickening, most likely from inflammatory response. This is before I knew I had IC. I'm bladder wall driven with pelvic floor. So Curtis, I think, so then the question we have to ask is, why would your bladder have been inflamed? Were you a monster drinker? Were you just massive when you were working, or when you were younger, drinking a massive amount of coffee or soda? That would be interesting. Because, the bladder, like any other part of the body, can be injured. And so if you're drinking massive amounts of acid every single day, you got to understand your bladder is not capable of surviving that. The bladder wall will break down. If I poured acid on the palm of my hand every single day, what do you think is going to happen? It's going to get redder and redder. And I am a fool. I keep pouring the acid on the irritation, redder, 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 until finally a wound occurs. And I'm still an idiot. And it gets bigger and bigger and bigger and bigger. You want sulfuric acid, and you should not do that with soda or coffee. The human body is not designed to survive acid all day long. It takes a toll on those tissues. And when you're young and you've got lots of, your immune response is good, your tissues are strong, your muscles are in good shape, etc., you might not feel that. But the wear and tear injuries really start to appear in your 30s. So you might be able to get away with the terrible diet in your teens and maybe in your 20s, and then bam, one day, ow, symptoms start. So Curtis said he's going to have a pelvic floor exam soon. Cool. It can be really interesting to see what that has to say. Curtis, I think you and I have talked before on the phone. I don't remember. I talked to so many people. Do you remember trauma? Or do you remember anything that occurred before your symptoms began? That would be a very interesting question. All right, so Angela asked a question, any ideas for the pain? So Angela, I would love to hear where your pain is located and what it feels like. If you could respond back in Facebook, that would be great. Oh my God, this flickering is crazy. Jamie says, many of us might recommend against installations and hydrodistensions. Doesn't mean it wouldn't work for you, but a lot of us might be able to offer less risky, less painful alternatives. I will tell you as a support group leader, one of the very, very first things that I decided for me is that I felt that my opinion should be the least important opinion in the room. Okay, why? Because my job as a support group leader is just to facilitate your discussion, not to change the content. Now that's different now because you're coming to me because my skill level with this is pretty high since I've written most of the materials that most of you read. What I don't want to do is turn anybody away from a one therapy that might work for them. That was always my nightmare. And so, my job here is to show you all the options and then kind of give you a kick in the butt and get you to read about them and talk to your doctor about them. I don't want to say hydrodistension is bad because I believe in hydrodistension. If your situation is severe, you're peeing blood. There's no substitute for eyeballs on the organ. Like if you're peeing blood, if I were peeing blood, it's like, what the hell is bleeding? Can you tell me? If the culture comes back negative, it's like, all right, why am I still bleeding? The doctor goes, oh, I'm not sure it'll go away. It's like, no. I want you to look. I don't want any guessing anymore. This is my body. I don't want to guess over pain. And that's a big problem is as a lot of us can be very passive aggressive and a lot of us can be fearful. And ultimately, in the end, it's about data gathering. It's about facts. If you've got blood in your urine, letting somebody look at your bladder to see what could be bleeding in your bladder is important. Hopefully, you will have read about hydrodistensions on our website. Know that we now do low pressure, short duration rather than high pressure to reduce bladder wall damage. I had one 3 years ago. It was no problem at all. It was no problem at all, unlike when they used to do them 10 years ago and 20 years ago, where they were much more traumatic. But you have to be informed if you're going to do a hydro. And with rescue installations, again, your first job before you even ponder a therapy is to understand your subtype. Because if you're subtype pelvic floor, there's no reason to do a bladder instill. If they've looked in your bladder and you're, okay, like seriously, go back 20 years. The number of people who called me and said, Jill, my bladder is normal. My bladder was normal. I had 2 cystoscopies. My bladder has always looked normal. Then I had a hydrodistension again 3 years ago. Normal. That's good, meaningful data, right? Because what that says is, okay, if your bladder wall looks good, there's no reason to do bladder. Whereas if you've got Hunter's lesions, then yeah, man, you're going to have to do something for those lesions. If your bladder's covered with red spots, which signify injury, then yeah, we got to do something about it. But if you're one of those people where your bladder is normal, they do a hydro or a cysto, and it is a baby bladder. It looks perfect, pink, etc. Then your bladder's good. It's time to look outside of your bladder, at your muscles, at your nerves, at other things. We have a list on our website of often confusable conditions, other things which can give you bladder symptoms, from a fibroid tumor to a chronic fungal infection to, interestingly, black mold in your house. We now know that if you've got black mold in your house, that can cause frequency urgency. The other thing that can cause frequency urgency is smoking. Smoking, God forbid you be a smoker and menopausal. Oh my God. I mean, every cigarette you smoke puts 20,000 toxic chemicals in your urine, if I remember the data correctly. And if you don't have a nice thick coating because you're menopausal, then you're allowing these carcinogens to touch your bladder wall and to bury themselves inside your bladder wall, which explains why smoking is the #1 cause of bladder cancer, my friends. And the tragedy here is that we also now have research that proves that secondhand smoke does the exact same thing in your children in your home. Many children of smokers have frequency urgency pain. And it's all from secondhand smoke. My mom smoked when she was pregnant with me. I grew up with a big smoker in the house. Man, there was nothing worse than washing your hair, getting all ready, and then walking into another part of the house where it was, like a opium den. It was so smoky. And you're just coated with smoke. It's like walking into a casino. It's terrible. Now, she hasn't smoked in 20 years. And it's a miracle she didn't have lung cancer. I don't know how. She was just blessed. All right, Curtis, getting back to Curtis. Curtis says, perhaps the bladder wall was thickened because the pelvic floor muscles were squeezing it. The bladder normally shrinks and so again, think about a balloon, right? Your bladder's kind of like a balloon. So when it's empty, it's fairly small and the walls are fairly thick. And then as it fills with urine, the walls stretch out and get. So a smaller bladder is what we're going to see. We have a much thicker coating. Thicker bladder wall. And so the question is why? And you're halfway right, you're halfway wrong. It's not that the pelvic floor muscles are squeezing your bladder. It's that the pelvic floor muscles are squeezing the blood vessels that support the bladder. It's very hard for the bladder to be healthy if it doesn't have good blood flow and good nutrition and good oxygenation, combined with the fact that those tight muscles are squeezing nerves, damaging nerves, and then those damaged nerves then eventually end up being damaged at the spinal cord, right where the bladder nerves are. And then we see the bladder nerves get sick, for lack of a better term. And a sick nerve in the bladder will cause the bladder wall to break down. So I asked Curtis why. He says, I got in a fight and pushed down on my lower back really hard in high school. I can't remember exactly when my symptoms started, though. See, that doesn't surprise me, hon. It doesn't surprise me at all. I've worked with a number of teenagers, high school seniors, junior college students. We can go right back to some sort of trauma happening in high school or school. Nancy says, do I take estrogen only vaginally? Heidi says, I'm breaking up. I don't know why. I hope that sounds okay. Barbara says, can I message you about a serious question? Yes, you can. Absolutely. My email address, icnetwork@mac.com, or just go over to our website, icnetwork.org, and use the contact form. All right, Facebook. Marion says, Jill, I've been on antibiotics for 3 months. For the last 3 weeks, I have all the symptoms back now. My put me on Monuril for the next 3 weeks. I don't know anything about this med. I don't remember it off the top of my head. Hold on. Fosfomycin. Hold on one sec. Oh, Barbara. I'm not going to talk about that publicly, but a girl. All right. I will respond to you. Do you want me to talk? I'm assuming you do not want a public response, so I won't respond to that publicly. All right, so hold on a sec. Fosfomycin. So it's a sachet dissolved in water, taken orally, maybe. I don't know, hun. I don't have anybody that I've worked with who have had a problem with it, but there's no way that I can tell you that you're going to be fine with it or not. But you are living proof that for many patients, antibiotics are simply ineffective because this is not bacterial. There's a small group of patients who it might be bacterial in, but the vast majority of patients, there's no bacterial infection. And it's be curious to know why you went on them in the first place. Did you actually test positive for infection, or were they just guessing? Jillian Lynn says, I'm 42, I hadn't gotten my period since October, but recently had it for a week and now I'm flaring. I was told about 5 years ago I have IC by family practice, but haven't been able to go to a urologist to have consistent discomfort and pain in my right side. I think is too high for the bladder. It goes around to my mid back where I would think my kidney is. This happened on and off for the past couple of years. It'll come on pretty strong for a few weeks. When it happens, I can't lay on my right side. It gets worse when my bladder fills. And she says, do you often see pain in front under the ribs? The answer is no. This does not present like we would expect a bladder wall injury to present. Because again, the bladder is in the center of the body. So the fact that you're having right side pain points us to other structures on the right side of the body. And it would normally be muscles. So I would want to know, have you had a pelvic floor assessment? Because your pelvic floor muscles, you got to understand the thing about IC and about chronic pelvic pain is healing happens. The human body never stops healing. The only time you stop healing is when you're dead. It is physically impossible to turn off healing in the human body. And one of the reasons why patients get better is because whatever injury they had has healed. But what you forget is you can be injured again. So you can fall on your pelvis again and trigger the pelvic floor again. You might be fine for 15 years until bam, you have a fall. Or your bladder might be fine, in your 40s, and then wham, in your 50s it's back because, believe it or not, it's estrogen atrophy. So it's interesting. Rebecca says, is there anything I can take while I do cancer treatment? My IC seems to have flares with estrogen blockers. Well, the reason your IC is flaring with an estrogen blocker is because your bladder needs estrogen to produce mucus. And so when you're on an estrogen blocker, you're putting yourself right into total menopause, and that is forcing you into something called the genitourinary syndrome of menopause. And so generally what doctors recommend is a bladder coating therapy. So either Elmeron, if you're willing to go through the risk of the eye disease, which, if you're using it short term, the risks are lower. Or you could do maybe one of the supplements that contain chondroitin that has a bladder coating effect. But so the concept here is to put an extra coating in your bladder so that the chemicals from the chemo are not damaging your bladder. Holly says, oh, Holly, I am devastated with my diagnosis of retina damage. Oh, Holly, I'm so sorry. Honey, life throws us the most unexpected curveballs. And you think you're doing something that is safe because the FDA says it is safe, and yet we all know that medications have risks. The problem here, and the reason why we have lawsuits right now, is because the company knew that there was the potential for eye damage, but they didn't tell the populace about it. That's why there's litigation. It should be on the label. You should have been we compare it to Plaquenil, which is used for lupus, and Plaquenil is what is it chloroquinolone or hydrochloroquinolone? It's what people were talking about as a possible treatment for COVID, which of course we now know it kills people when you take too much, which is why they stopped the clinical trials. Plaquenil is notorious for retinal damage. So much so that the label is crystal clear about the risks. And the label encourages patients to have an annual eye exam, but also to have a thorough retinal exam in your first year of using it as a baseline, and then to have annual eye exams after that, so that they can monitor any damage that might be occurring with Plaquenil. And in that first lawsuit filed in the district court, they specifically show that the Elmeron label says there are warnings none, when there should be a warning about the eye damage. John says, I continue to struggle with urethral pain that I can't get under control. I've been doing pelvic stretches without much success. I've had numerous physical exams and cystoscopies. I'm not sure what to go next. So John, tell me then, so you've been doing PT. Has the PT given you any progress at all? Are muscles at least relaxing? Nicole says, I think it's so hard explaining to your doctor how you feel. They often dismiss you. Yeah, they do. They do. And you know, part of that, listen, I love the IC doctors that we work with. You couldn't find a more dedicated group of people caring for patients. I'm talking about the top tier doctors, the Rob Moldwin in New York, the Robert Evans in Wake Forest, the Ken Peters at Beaumont, along with a handful of others around the country. You know, they have dedicated their careers to helping you. The challenge is that they're researchers, they're engaged, they go to conferences, they're up to date on all the latest information, they talk to each other, they talk to patients, they collaborate. Man, they have a tremendous sense of humility. They're not know-it-alls. If somebody comes in with something that they don't understand, they talk to their colleagues about it. That's the type of doctor you want to work with. The type of doctor that is hard to work with are the arrogant pricks, the ones who say, hey man, I know everything I need to know. I don't care about you. You got IC. I'm giving you Elmeron. Get out of my office. And here you are going, but doctor, I've got pain over here on my left side. But doctor, I'm having this. It doesn't make sense. So you would like to be able to go to a doctor that is a warm and fuzzy. And I will tell you that the top tier doctors are warm and fuzzies, with the exception of one that I usually don't send people to, because that doctor can be incredibly mean. And even though that doctor is very, very good, it's not a safe place to go. If you need comfort, that's not the doctor we're going to send you to. We're going to send you to a different type of doctor potentially. But the other thing you've really got to understand is that when they went to med school, they knew, guys, this isn't taught in med school yet. They're barely teaching it now. The first question about IC on the medical board exam occurred the same year we had the San Antonio IUA conference. So 5 or 6 years ago, maybe 7 years ago. And local doctors, local urologists, regional urologists, they have tiny budgets. They don't go to conferences and take classes on IC. They go to conferences maybe once every 5 years, and usually they're going to take a class on cancer. There's such good things happening with the IC world. And so you are the educators. You are the ones who have to go in and say, hey, doc, here's this really interesting research study that shows that Elmeron can cause retinal damage. Did you know about that? And the doctor's going to go, what? No. You. And you need to be a part of your treatment. You need to be informed, bearing gifts. Every time I went to my urologist, I always brought him articles. I always did. And he liked me for that. I brought him stuff. So hold on a sec. Oh, see, okay, John, darn it. You know what? I know you just responded to me and now I've lost it. Dang it. Again, Facebook won't let me scroll back. Come on. So frustrating. Okay, John, you'll have to respond again because I've already lost it. I can see, the last thing I can see is Karen saying, are you avoiding acidic foods? If you're having back pain, low back pain, so if you're having sharp low back pain, we're going to be looking at your kidneys, make sure you don't have a kidney stone, but we're also going to be looking at your psoas muscle. You've got a big ropey muscle that goes up both sides of your spinal cord and then anchors deep into your pelvis. And it's that pelvic floor psoas muscle that can be causing a lot of back pain. Sue says, I've been using installations when I've had bad flares. Here, hold on, man. I gotta, this flickering is driving me crazy. All right. Sue. I've been using an installation when I've had flares and have helped me, but a few times installations don't work. I test for UTIs, I don't have a UTI. I find that antibiotics help me. You know, antibiotics have a nice anti-inflammatory effect, but Sue, it's all about subtyping. We need to know what your subtype is. Is it bladder, wall, pelvic floor, pudendal neuralgia? Please go on over to our website and watch our video on the subtypes of IC. Because the antibiotics might help you, but the antibiotics could potentially hurt if you've got a chronic fungal infection. And a lot of IC patients have chronic fungal infections. And we know that from our own Federal National Institutes of Health research. Emily says, other than pelvic floor physical therapy, what can be used for pain control that is not opioids? Well, if you have tight pelvic floor muscles, you would be using a muscle relaxant like Flexeril or Baclofen, which I did last night. Took a half of a Flexeril last night because my neck muscles are insanely tight right now. If your nerves are involved, you could do something like Neurontin. You do something like Neurontin. Or oh gosh, oh my God, did I just flash you guys my underwear? Sorry, it's hot here. I'm wearing a short skirt. My bad. Okay. Peora, P-E-A-R-A, PEA is known as palmitoethanolamide, and palmitoethanolamide has been proven in research studies to dramatically reduce the pain of IC. That research study was presented a year ago at the American Urology Association conference. The study was done in Italy. It was a fantastic study, and so I would be really looking at Peora as something that might be helpful, worth a try. There were no known side effects in that IC study. And in the vast majority of studies using PEA for chronic pain, there are no side effects reported. This is what I take when I'm feeling my nervous system start getting quite prickly. Veronica says, I wish there was a pill I can take to help with my IC. My pain is controlled by diet. Veronica, there are. It's supplements. If you want something that has a bladder coating effect, girl, there are pills. They're over-the-counter supplements. Oh. All right. So remember, the American Urology Association published a 6-step treatment protocol for IC in 2011. They amended it in 2014. In that protocol, there's 6 steps of treatment, and it's arranged with respect to the risk of adverse events. So obviously, they don't want you to do something that's very dangerous. They want you to start with the easy, less risky stuff first. So in step 1 is water intake, muscle relaxation, stress management, diet modification, and supplements. They specifically mentioned the use of over-the-counter nutraceuticals. They have been used for 20 plus years now, quite successfully by many, many patients who cannot afford Elmeron or who have side effects from Elmeron. Most of them are based around chondroitin as a bladder coating. So what do you have? You've got the one that was the top supplement for many, many years was Cysto Protect, which has chondroitin for a bladder coating effect combined with quercetin for an antihistaminic effect. It fell out of favor last year when it came out with a cancer warning, and it was just for a food coloring in the pill. It was never recalled. Nobody was ever harmed from it in any way that we know of. But the new ones that we have, they removed that one ingredient, titanium dioxide. So Cysto Protect has been what was the top supplement for 20 plus years. It was invented by federally funded ICU researcher, Dr. Theo Herides at Tufts University. So we had been waiting because we've learned a lot about IC since this was developed, and I've been waiting for Dr. Theo to create his next formula, because we learn new things, right? He didn't. He has a non-compete agreement. He's not allowed to create another bladder supplement that would compete with Cysto Protect. So another doctor, Dr. Gio Espinosa, invented Cysto Renew. And Cysto Renew is very interesting because it had the core ingredients of Cysto Protect, but he added lemon. So he added two things. He added lemon balm. Now, lemon balm is a mint with a lemony scent. It is not citrus lemon. Lemon balm is known for its ability to calm nerves down. Remember that. That's important. The other thing he added to this was a little bit of aloe, because aloe can be calming and soothing to the bladder wall. Unfortunately, quite a few of you are irritated by aloe. It gives you gut distress. So if you're an aloe sensitive person, you're not going to be able to do Cysto Renew. Then we had a new company come on board who convened just a top tier panel of experts, including national IC experts, to help us create a new line. I was also on that committee. And that's the committee that put together Bladder Builder, that's been out for a year now. And the reason why Bladder Builder is so freaking cool is because it's the first supplement that has PEA in it. So it's got the pain fighting ingredient with the bladder coating ingredient. So the most comprehensive formula on the market is absolutely Bladder Builder. Hands down, Bladder Builder. If you are somebody who is more sensitive and you're afraid to try really big, robust formulas, and like me, because I'm Miss Sensitivity, so if you're somebody who flares when you take probiotics or something like that, then you're not going to do Bladder Builder. You're going to do a much cleaner, simpler formula, Bladder Rest. And Bladder Rest and Cysto Protect are very comparable. It's $10 cheaper, made in America, right? And so Bladder Rest is an option there. It is being reformulated. The next run that we get is going to be slightly reformulated. And then if you don't have to worry about your bladder wall, it's because you're not IC subtype 1 or subtype 2, you're subtype 3 or subtype 4 or subtype 5, then Peora. So remember how Cysto Renew added the lemon balm to calm nerves down? Well, now we have the ultimate ingredient known to calm nerves down, palmitoethanolamide. And so Peora is it can be taken with whatever else you're doing in terms of supplements. It's again very, 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 very few side effects associated with this. You can go to our website, click on our store, and you can get the spelling for it, palmitoethanolamide, and you can Google it, look at some of the other studies, but I'm telling you, it's pretty good. So there absolutely are supplements that you can take that might help. I can't say they will help, but a lot of patients are using them. Becky says, estrogen atrophy can affect younger women who have not had a hysterectomy. That's true. It depends upon it's all about genetics, and some people start going into menopause in their 30s, perimenopause. Anne says, what's the latest word on Lyrica? I don't have any words on Lyrica. April says, I'm glad to have caught this video today. I was diagnosed with IC approximately 20 years ago. That was when I had a full hysterectomy at 40 years old. I've had 2 bladder lifts. I do not know exactly what type. Sorry, I will have to dig deep. As I speak about bladder pressure, my OBGYN put you on Mirbatrix, which does help with the incontinence, but many of the side effects is memory loss. I also have issues with short-term memory. Do you have any input? Thank you. Please, you never have pain. You just have bladder pressure. So, April, are what I would consider a surgical injury patient, that you had no symptoms until immediately after your hysterectomy. And you've had 2 bladder lifts. So you've had 3 major pelvic traumas because you've had 3 major surgery. Anytime you have surgery, because so many things are involved here. So I mean, and you'd be stunned at how often this comes up. It comes up a lot after hysterectomy. So number 1, your muscles could be tight. Number 2, your bladder could have been compromised in some way during the surgery. They could have stitched your bladder accidentally, maybe cut your bladder accidentally. With bladder lifts, though, it's so interesting. I was working with a patient who had a bladder lift, I don't know, a couple of years ago. And when they do bladder lifts, you have to understand that the skill of the doctor is everything, right? Because there's a natural tension to your muscles and to your ligaments and to your tendons. There's a natural tension there. And as your doctor removes things and then puts something in to place it, they have to use their fingers to feel the tension. There's no easy way to do a perfect match. And so I was working with one patient who had a bladder lift, and as soon as she woke up, it hurt, and it was bad. And it turned out that it was just way, way, way too tight. And the doctor had to go back in 6 months. So, I mean, she went through 6 months of utter hell. She could barely get out of bed. She could barely walk. The guy had just sewed her up way, way, way too tight. And finally, she was able to get the doctor and convince the doctor to go back in and relax it a little bit. Now, the fact that you had a second one means maybe they went a little bit too loose. If you're incontinent, if you're still struggling with continence, then maybe your muscle, they just didn't get the tension right, and they just went too loose twice. I don't know. Love to talk to you about it sometime. You should give me a phone call this week. I'd love to talk to you about your surgeries and what your symptoms were afterwards. Hello, Fawad. Nice to see you. Pretty good. I had to sleep in my recliner last night because I almost dislocated my jaw on my left side the night before. My stress is right here. That's where I show my stress for COVID. DJ said, I've had a hysterectomy 6 years ago at 33, radical hysterectomy. I wasn't given estrogen for 6 months. I still have muscle pain where my ovary was, but the IC pain is completely different. Yeah, but you have to understand that certain muscles, like, again, the urethral diaphragm muscles, will cause bladder pain, frequency, urgency. Don't underestimate that. Hi, Beth. Beth says, what do you think about coming off the pill as it relates to vulvodynia? I'm trying it now under the care of my pelvic floor after 30 years on it. Curious if you know anyone who had good results. Hun, this is always one of those situations that I find incredibly distressing, that you were on medications for 30 years, especially a hormone regulatory medicine, because what that means is that we don't know what your normal is. And now that you're going off the medication, we're trying to find your normal, and your normal is going to be postmenopausal dryness. And you said that you're gaining weight and you're hating that. Remember too, hun, speaking as somebody who's been there, um, that one of the things you see after hysterectomy is a little belly. Like I got an inch or two of fat on my belly I didn't have 3 years ago. That kind of makes me crazy because I don't like having fat there. But that's where they think the reason why older women develop fat on their tummy is because that's where we store estrogen. So even though we don't have our ovaries anymore on our body, and that's what the liver does. The liver sends stuff around to different parts of the body and stores it. Estrogen tends to be stored in fat, and so there's kind of one school of thought that the reason why we get our bellies is because that's where our body is storing some of the hormones. Um, you know, it, you might be coming off the pill for the vulvodynia. I guess the other question is, can you swap and you start using a topical estrogen cream that would at least you can put directly on your vulva that would help your body produce mucus right on your vulva. Nancy says, I'm ordering some PR online. Do I have a promo code? I don't, because it's $29. I will tell you that when we get our next shipment, it's going to go down to $24 just for probably the summer. $24.99. So Nancy, if you want to wait and call me tomorrow, and you just have to talk to me, you're not my staff, talk to me, I will give it to you for $24.99. We were trying to come up with ways that we could help during the COVID crisis because so many people are struggling financially, and the company, the manufacturer, and the company and myself, we have all agreed to donate various manufacturing costs to price. And so we're going to be letting the Peora go for $24.99 for probably 3 months. This is the cheapest and really the most effective supplement for somebody with pain. And so if money is tight and pain is the issue, rather than spending, twice as much on a bladder supplement, maybe the Peora might help. I don't know. I mean, we're just really trying to think about what we can do to be helpful. Can't do that much because everybody's down, so it's hard. Curtis says, you have trouble seeing in dim lighting and focusing. You were in Elmira for 5 years, quit late last year, got your eyes checked by your optician. He said they look good, no sign of degeneration. Should we see an optometrist just through? No, you should not see an optometrist. You should see you need to see an eye doctor, not a vision doctor. And if you're having trouble in dim lighting and focusing, you absolutely need to have a retinal exam. Lee says, I have IC, and where I cannot go to the bathroom lots of times, 6 to 7 hours. So Lee, listen. Number one, U.S. law is really crystal clear. In U.S. law, you are entitled to use the restroom when you need to use the restroom. That's very hard on a production line. I've done stories of that on our website. If you go over to our website, icnetwork.org, we've reviewed the law about restroom access. Generally, they're not supposed to restrict restroom access for any extended period of time. If you need to use the restroom, you're supposed to be allowed to use the restroom. If you're on a production line, that means your supervisor steps into your position while you run to the restroom. And if there's one thing we know about ICers is we can pee on and so usually using the restroom is not a long thing. One company got into trouble because they basically forced women to wear diapers, incontinence pads on the production line, and told them they had to pee into the diaper. And in fact, that also happened at Sears in Texas with a patient that I was working with in retail. And her supervisor told her to wear an incontinence pad, which again, totally illegal, is completely inappropriate, and goes against all of our workplace safety laws and regulations. That said, Lee, that is an option, but I think it's important that you know your rights. But given the fact that you don't have a lot of restroom access, you're torn. You drink water, you're going to need to pee. But then the problem here is if you don't drink water, your urine's going to get really irritated. And I would assume that by the end of your workday, your bladder's probably on fire just out of dehydration. So in that context, until we can work out the restroom access, doing something that would protect your bladder would be reasonable. And I think Bladder Builder would be the best choice because it does have the pain fighter in it. It does have the PEA in it, which might make it more comfortable while you're working. So I would think that this would be a very interesting experiment. Dolly said, I had an ablation done and I have burning pains on the sides of my pelvis. Does this mean my tubes are filling with blood? Do you had an endometrial ablation? What kind of ablation did you have, Dolly? And does this mean you have burning pains? And when did you have this done? You have burning pains on the sides of your pelvis. Does this mean that your tubes are filling with blood? Honey, there are no tubes on the side of your pelvis. If you're talking about pain by your hip, no tubes there other than on the left side, your large intestine. So I would suspect that it would probably be muscle tension because whatever you was ablated is screaming in pain and your muscles are going to get tight to protect you. We call that the guarding reflex. Fawad said, is IC bladder issue is linked with mental health last week? My friend told me to. All right. Now listen. IC is not a mental illness. It is not a mental illness, even though, now you guys, hopefully you know the history here, and that is the first published report of IC was in England about 1850. And if you read that magazine, it is perfect for today. It absolutely describes a perfect IC patient even today. Then, and around 1915, 1920, Dr. Guy Hunter invented the cystoscope, where he was able to look inside the bladder, and guess what he found? Lesions and stuff, which is why they're called Hunter's lesions, named after him. Clearly, a Hunter's lesion is not a mental illness. And then over, from the 1920s up to the early 1950s, the IC research was staggeringly good. And we had proof that IC happened in men. We had proof that it happened in children. And then it all stopped in the mid-1950s when two arrogant doctors published a paper, a case study of one woman with IC, unexplained frequency urgency pain, that they believed was unexpressed anger manifested in the pelvis. And from that point, literally to 1990, medical schools often taught patients that this was a mental illness. And yes, some patients were committed to psychiatric institutes, at which point in time, 24, 48 hours later, they were discharged with profuse apologies when the doctors at the psychiatric hospital realized they had a bladder problem. So IC is not a mental illness in any way, shape, or form. However, anytime you're in pain, there's anxiety. It's like, why am I in pain? Throw in being sleep deprived because you're getting up to pee every 30 minutes or every hour. So you don't have normal restful sleep, and you're not going to be your normal self. You're going to have issues. You're going to be cranky. You're going to be irritable. You might become depressed. You might become anxious. And that's normal, not just for IC, but anything like this. You're human. It's okay to be stressed about it. It's not okay to attack other people. It's not okay to insult other people or be aggro on them. But this is hard. This is hard. You have never worked so hard in your life as you are working at this very moment. Because you have to advocate for yourself when you feel like crap. And it's hard. So if you find that you are struggling emotionally, I absolutely say, find somebody to talk to. Find a psychologist who specializes in pain to talk to. You're not alone in this. You're not alone in this. We don't want you suffering in silence at home alone in your bedroom. I don't want you not leaving your house. I don't want you to become, a patient who's homebound. It is okay to talk to people. It is okay to ask for help. God didn't give you the skills to deal with IC when you were born. You have to go learn them. And you go learn them from an expert. Don't try to recreate the wheel. Go talk to somebody who's good. Okay, hold on. Rissa, my pelvic floor issues resulted from a car accident. Took months of therapy. Tests, treatments, in the office, medication. Pain was so bad I come close to passing out. You had leakage. It's since went down, but life will never be the same. Working out, sexual life. Is there a permanent fix for this? So, Rissa, you are the perfect example of why subtyping is so important. So, at some point in time, a doctor said, you've got IC because you're peeing all the time and you might have pain. That's not good enough. Listen, you had a car accident. You had a car accident. What was the injury from the car accident? Was your hip broken? Was your pelvis crushed? Anything at all like that? You are an injury patient. You are a profound injury patient. And the one thing you can trust is the healing is always happening. If your body can fix it, believe me, your body's trying to fix it right now. But what we really need to figure out is what's the trauma. The odds are that you probably have some pretty significantly damaged muscles that are now compressing nerves. And so, I always say to every patient, you are an anatomical mystery to be solved. And in the case of trauma like this, you really are an anatomical mystery to be solved. We need to understand the toll and the trauma that car accident did to you. But the fact that working out hurts, the fact that sex hurts, the fact that walking hurts, that's not your bladder, that's your muscles. That's your muscles. So and it's not just pelvic floor. Remember that your pelvis is going to reflect any trauma from your legs and stuff like that. And so we got to get your legs checked, got to get your feet checked, got to get your back checked, all that sort of stuff. All the things that an accident would affect. I would love for you to call me this week. I'd love to talk to you. April says, after hearing what you just said, I've fallen on my bicycle tire, hitting my tailbone, age 9, age 15. I hit my most delicate area on a man's bicycle when the brakes went out on me. Had to go to the hospital because it turned into a blood clot. They had to drain it. Could there be a connection? Yes, 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 yes. That's what we continue to see is recurring traumas to the pelvis. So you hit your tail, you fell on a bicycle tire and you hit your tailbone. That's trauma number 1. Trauma number 2 is you jam your crotch on a bicycle so badly that you had a blood clot. And so we know that compression injury, bam, it broke blood vessels because you had a blood clot, but it also broke muscles and it also potentially broke nerves. Nancy says, I have that problem. Someone smoking their secondhand smoke flares your asthma. Okay. Toby says, if your bladder wall looks good from a cystoscopy, why is food still a trigger? Okay, so Toby, this is what you're not understanding. And this is what everybody has to understand. And you really have to get this book. This is called Breaking Through Chronic Pelvic Pain by Dr. Jerome Weiss. It is the best book written in 50 years. So remember we talked about the pelvis. The pelvis is your command center for your brain's your command center. Your pelvis is like your workhorse. It carries the weight of your torso. It deflects the pressure and stress and force from when you walk, right? So in this book, he brings up 3 critical points. The failure of Western medicine is that doctors stay in their box. Urologists stay in the urinary tract. Gynecologists stay in the reproductive tract. Gastroenterologists stay in the bowel. And they don't understand interrelationships. And what he argues so perfectly is that you cannot consider one without the other when it comes to the pelvis. And the main reason why is because the nerves are shared with the spinal cord. The nerves for your bladder The nerves for your muscle and the nerves for other things actually all meet at the spinal cord, and they are right next to each other, and they influence each other. So he argued about two reflexes, and they both happened. One is called a viscerosomatic reflex. Now that's a long, complicated word for the guarding reflex. So can an organ change a muscle? And the answer is absolutely. If you have bladder pain, that pain is going to be sent to your spinal cord, and your spinal cord itself is going to trigger muscle tension. So we also call that the guarding reflex. So we know that an organ can change a muscle. If that organ is screaming in pain, the muscle is going to get tight to protect you. But the real question is, can a muscle change an organ? Also known as a somatovisceral reflex. And the answer is yes. And I remember Dr. Theoharides trying to explain this to me 25 years ago, and I didn't really understand it. So when you think about, here, hold on. Let me get this picture. Oh, I hope I didn't flash you guys again. Oh my God. All right. Okay. So I want you to look at these two pictures. So this is a picture of Hunter's lesions, right? Okay. So we know not mentally ill. These are big, bloody freaking wounds on the bladder wall. IC subtype 1 Hunter's lesions. They're known for a stellate appearance. They have a big red center and arms radiating off of that center. This has now been associated with viral infections. Okay, so we now have a couple of research studies showing that Hunter's lesions could actually be the Epstein-Barr virus infecting the bladder wall, or the polyoma BK virus affecting the bladder wall. Okay, this is only 5 to 10, 15% of the IC patient population. Okay, so let's look at this one for a second. This is a more typical bladder scan for IC subtype 2 bladder wall driven. So, I mean, again, not the same. We can all admit this is not the same, which is why it's so sad that they're treated the same when they shouldn't be. This is a bladder wall injury patient. This is what the bladder looks like when it gets injured. So the question is, how does the bladder get injured? Well, I mean, like any other part of the body, it can be injured. If you got shot, it would be hurt. You could shoot a bullet right through it. If you got stabbed, it could be hurt. If you poured acid on it every day, something from the outside in, or chemotherapy or ketamine, we know that they have a solvent effect and they're going to damage the bladder wall. But let's go back now to the somatovisceral reflex. So in the somatovisceral reflex, the question is, can muscles change the bladder? Could a muscle dysfunction cause this? And the answer is yes, it can. And it's a fairly complicated explanation. I will try to simplify it as much as I can. So when you suffer, bam, a compression injury, bam, okay, you have fallen. You have squeezed muscle fibers. You have damaged muscle fibers. You have damaged blood vessels. If you have bruising, that's proof you've broken blood vessels in that fall. You've also damaged nerves. Okay. So the first area that gets screwed up are the muscle fibers, because that area where you've compressed them gets weak. It's traumatized. And so it goes, right? The muscles will just spontaneously go, ow. And I mean, that's a simplified way of saying it. But what happens is you get trigger points in that area. There's a muscle knot in their area. I got a ton of muscle knots right here. like, oh, holy hell, the muscle knots are so bad. I have to work on them because they're really messing with my jaw. Okay, so where you fell, that area has been stressed and now has a trigger point. The problem with a trigger point is it's a muscle knot. It's like a permanent compression injury. Until that trigger point is resolved, blood is not going to flow through that trigger point easily, and nerves are certainly not going to be able to function well if they are in the area of the trigger point, if the trigger point's wrapped around where the nerve is. So concept number one is that the muscle fiber itself is damaged. Concept number two is the nerve damage, because your nerve fibers, like your pudendal nerve, right? Your pudendal nerve comes off in 4 sections off of your sacrum. It merges into one nerve. The pudendal nerve goes through the Alcax canal, and then when it leaves the Alcax canal, it then splits into different sections to innervate your clitoris, your perineum, all that sort of stuff. So, when we think about nerves, we really think it's like a nerve. It's like a nerve. Okay, it's going from A to B. What we don't often understand is that in that long nerve fiber, there's actually multiple things. There's a nerve going down, and sometimes there's a nerve going up. And for a nerve to be healthy and normal, there's always a little tiny blood vessel inside that nerve capsule that supports the nerve function. But guess what? Bam, you fell. Bam, you squeeze the nerve fiber. Bam, you compress the nerves. And more importantly, bam, you broke the capillary inside the nerve itself. Now, here's where it's tricky. Those nerves need blood supply to function normally. If they don't have blood supply, they stop working. What happens is at the nerve synops, when the nerve goes from one nerve fiber to the other nerve fiber, it jumps across a nerve. So the nerve impulse hits the end of the nerve, and then something called a neurotransmitter, acetylcholine, is released, and it jumps to the next nerve, and it triggers that pathway. There is also a spontaneous release, but that calcium is almost immediately reabsorbed to be used the next time. But guess what? If you don't have blood supply, the calcium cannot be reabsorbed. So the nerve basically becomes exhausted. It cannot do the work it needs to do because the blood vessels are broken. And this would apply to the initial fall, and it would also apply to a long-term trigger point. So now we have a sick nerve. And the way nerves work is that if the nerve over here gets injured, then the nerve here gets injured, the nerve here gets injured, the nerve here gets injured, the nerve here gets injured. That basic, he calls them sick nerves, moves all the way up to the spinal cord, where it is proximal to the nerves of the bladder. So then the nerves of the bladder get sick, they get injured. And then we go right back down directly into the bladder wall, where that injury then spreads back down to the bladder wall. An injured nerve releases something called substance P. Substance P damages tissue. And if I could show you my screenshot, hold on. Is this it? Okay. So while you and I might not understand the mechanisms of what is happening here, the doctors do understand the mechanisms. So one of the reasons why they often recommend a tricyclic antidepressant is to calm these nerves down, to reduce the release of substance P. Then the other thing that's often recommended is an antihistamine, because an antihistamine helps control the mast cell release that happens when the tissue is damaged by this. You guys, I know that this is arcane science, and I know that I'm probably way over your head because it's way over my head too. Let's just come back to this picture. So what the hell's causing this? It could be a sick nerve. A sick nerve releasing substance P. The substance P causes localized irritation. That substance P then triggers mast cells to release histamine, and you're stuck in a vicious cycle of inflammation right here. And that's why they give you the tricyclic antidepressant and the antihistamine to control potentially any of this. But that said, the question is, what caused this? And the answer goes right back, hello, to that original nerve injury. So how do we fix it? It's all about blood supply. Yes, you have to protect your bladder wall. Yes, your bladder wall is compromised. Yes, you have to follow the diet. But if you do all that, but you still have tight pelvic floor muscles, restricting blood flow to the bladder and compromising those nerves, you will never get better. We have to work on the muscles too. Just as if you do the muscle work and you don't protect your bladder, you're a fool. You know, that's why we do both at the same time. Chicken versus the egg. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor. The reality is that they're both involved. They're both involved. You got to work on both of them at the same time. Sorry, I mean, the science is fascinating. I like the science. I'm a geek. Lupita says, I was recently seen in the ER and they prescribed doxycycline and Bentyl. The ER doctor said no infection, but just to take it. I feel pelvic pressure, and when I walk, it feels worse. I've been doing a diet change, but don't know what to take for the bladder to heal. Girl, if movement triggers your pain, we always look at muscles. It's important for you to have a pelvic floor assessment. If your flare may be caused by a muscle injury and your pelvic floor spasming. You guys are so good supporting each other. I'm so proud of you. Hey, Valerie was recommending a doctor, Stephen Goldwasser in Jacksonville, Florida. Valerie, could you email me his information so that I can add him to our doctor list? Meg says, who are the best doctors in this field? The best doctors in the field at the national level are going to be Robert Moldwin in Long Island, New York, so Beaumont Health outside of Detroit and Royal Oak, Michigan. Robert at Wake Forest in North Carolina. Christopher Payne out here in the San Francisco Bay Area. Robert Eckenberg, who's an OBGYN who's dedicated his career in Pennsylvania. Those are really the top tier doctors in the United States. They're all getting close to retirement. So it's going to be very interesting to see who's going to fill that gap when they're gone. Alice says, I had great success with the Correct Toes product with my pelvic floor issues and bladder pain. What's Correct Toes? So what she's referring to is one of the key questions that we have, especially for IC subtype 3 and IC subtype 4, is why do trigger points reoccur in the same place? You can go to a physical therapist. They can fix your pelvic floor, trigger points gone, nerves calm down. But 2 weeks later, 2 months later, they're back. Why? And why are they always in the same place? And that is what we would consider a mechanical issue. Usually what that means is that there's something wrong with bony structures that are putting tension on the muscles in that unique location. So if you get SI dysfunction, if you've got one leg shorter than the other, or you got scoliosis, or Or something as simple as a foot problem can create long-term pelvic floor tension, especially if you've got Morton's toe, Morton's neuroma, if you're pigeon-toed, whatever. And so Alice is saying that she found a product called Correct Toes, which has helped her tremendously. I completely believe it. Let me look at it. I've never heard of Correct Toes. Relieve foot pain while being active. Oh, okay. So it's basically kind of anatomical toe spacers designed by a sports podiatrist. The only toe spacer that can be worn barefoot or inside approved footwear. Oh, how cool is this? Correcttoes.com. Baby, as you were born with perfect feet. Baby's feet are designed to provide balance and stability. With a broad sole and splayed toes, feet form our foundation. In our society, foot shape and function changes as we age. As feet are exposed to conventional footwear, toes compress and curl. Rigid footwear and arch support diminish muscle activation and toe range of motion, causing weakness and atrophy in the foot. Hello? Seriously, high heels? No. You want to screw up your feet and your pelvic floor? Wear high heels all day. Do not do it. With the long-term use of restrictive footwear, our once dexterous and mobile toes lose their ability to move independently. In cultures around the world who remain barefoot or minimally shod, toes maintain their natural shape and splay, and foot and toe strength is preserved through adulthood. Oh, wow, look at this. I got great pictures of blood vessels, ligaments, bones. How cool is this? Oh, I got to check into this. Oh, I got to write this down. Thank you. Thank you. Thank you for sharing. I got to check that out. Awesome. And affordable too. Cool. Okay. Thank you. Thank you. Thank you. Thank you. Is there a good doctor in Kentucky? The University of Kentucky has a Dr. It's the only IC researcher who did a study in IC. I had heard, though, she wasn't treating IC patients. I don't know. You could try her, Dr. Deborah Erickson at the University of Kentucky. Meg White says, pudendal versus bladder, how to know? I don't know. The pudendal nerve really innervates the clitoris. Remember, pudendal nerve injuries are very. If you have pain as soon as you sit down, that is a pudendal nerve. That's your pudendal nerve talking to you. Your bladder doesn't normally talk to you when you sit down. Your pudendal nerve will immediately talk to you when you sit down if you have a nerve problem. Jennifer says, how do you find a fungal infection in your bladder? And sorry, somebody's complaining about the sound. So how do you find a fungal infection? A next generation urine test. The best way to find a fungal infection in your bladder is with DNA urine testing. And if you go to a website, bladderhealth.org, that would be the one to go to. It's called Next Generation DNA Urine Testing. It tests for bacteria and for fungus and for viruses. If you suspect a virus, but you have to request a more bold test. The simple, affordable next generation testing is $299 $199. And it will identify all the bacteria in your urine and any fungus in your urine. And remember, we had a research study. This is fascinating. Remember, with the human biome, everybody has now really been trying to study the normal and natural flora in the human body that makes us thrive. So we have good bacteria in our body, for sure. We have bacteria in our body that produces food that helps nourish the cells in our gut. So not all bacteria are bad. There are good bacteria in our human body. One of the things that bacteria do, though, is they control fungi. They control candida. And if you take an antibiotic, you kill everything, good and bad. And that's why candida infections flourish after antibiotics, as well as potentially getting C. diff, which is a really, really bad pathogenic bacterial infection that happens when you take antibiotics. We just had a research study. So we have multiple research. Fungus plays a role in flares in some patients. So what the MAP Research Network, the federally funded multidisciplinary approach to the study of pelvic pain research network, found is that many patients having flares actually had fungal flares. They were having candida flares in their urine. And of course, here you are, you think it's infection. They do a typical urine test. It comes back negative and you're crying in pain. And the reason why is because a typical urinalysis doesn't test for fungus. So they don't even look for it. And then what do? They give you antibiotics anyway, which then makes the fungus even worse. And that's why so many clinics have moved over to next generation urine testing, because it will help them make a better decision about what could be involved. The challenge here is a lot of doctors don't know about it or poo-poo it, but those top tier doctors, as well as infectious disease specialists, are all using this now. This is the future of urine study. The challenge is that we just don't know what the normal is. Is there supposed to be fungus in our urine, in our bladders, in our urinary tract? Possibly. We don't know. Is there always going to be a small population of candida in the bowel? Maybe. That's what the biome studies are focusing on, is what is healthy, what is normal. But we did have another research study. It was in our last magazine, the IC Optimist magazine. And let me just say, guys, if you like these streams, please, please, please become a member of the IC network so that you can get our wonderful magazine, which shows all of this. I write this magazine. Stacy and I, along with guest writers, write our magazine. Written by IC patients for IC patients. This is about, I want you in 5 minutes to learn something that you can talk to your doctor about. So you're not going to find brag pieces in here. This is about real, useful, helpful information. And anyway, we always review the latest research, and a fascinating new fungal infection study came out, where they were able to determine that the patients with more fungal species, actually had more intense pain. That is absolutely fascinating. And that was, again, the MAP Research Network. So here we go, a year-end look at the MAP Research research in 2019, the premier IC network in the world, right here. They're the ones. Listen, this is not some wacko redhead from California giving you obscure theories here. These are published in major medical journals, the best of the best doctors. And so it's in here somewhere. Here it is. A study published in April 2019 looked at the role of fungi in female IC patients. Researchers collected urine samples from IC patients at the beginning of the study, then again at 6 months, and again at 12 months. 13 fungal species were found in the samples collected from 202 patients. Patients with more severe symptoms showed a greater fungal diversity, as well as an increased presence in candida. Researchers concluded that their findings suggest that the severity of urinary symptoms is associated with the presence of fungi in urine. So for those of you out there who are focusing on chronic bacterial infection, you are looking in the wrong direction, because what we're finding is fungal infection. So those doctors who are giving you antibiotics for long term, that's potentially just making it much worse. Fascinating, right? Linda says, I have pain at night after I get up to go to the bathroom. I'm fine in the daytime. What can I do? So Linda, pain after urination. I mean, there are a couple of things that are going on. Number one, pain woke, it sounds like the need to urinate woke you up. And so we got two issues going against us then. Number one is you're awake and you're now paying attention to your bladder. When you're in a deep sleep, it's a little bit harder to pay attention to your bladder. So you're more aware of it. But more importantly, though, is pain after urination is also associated with pelvic floor spasms. So I have to wonder if maybe there's something in the way you're sleeping that is triggering your pelvic floor. Interesting. So again, if you want to know if you have a fungal infection, the only way to do that is with a next generation test. And I recommend it. I absolutely recommend it. It is data. I think every IC patient should have their urine tested with DNA testing. Just out of curiosity, see what the hell's in there. Urinalysis will miss 95% of the bacteria and all the fungi. Next generation testing will tell us everything. What it doesn't tell us is what's normal and what's not normal for you, but at least it will tell you if you got fungus in your urine. Mem here now says, I'm going to take the next gen test. I read that IC can be a constant infection embedded in the bladder wall. It can be. But again, what is it? Is it bacterial, fungal, or viral? If you've got Hunter's lesions, the odds are it's viral. That it's Epstein-Barr, polyomyxa BK, maybe even HPV or herpes. You know, infection isn't just from bacteria. You can have a viral infection and you can have a fungal infection. So do I believe that chronic embedded infection is possible? Absolutely. But I'm not going to put my money on chronic bacterial infection. I'm putting my money on chronic fungal infection because that's what they're finding. That's what they're finding. And you look at our history. Seriously, if there's ever a group of patients completely overexposed to antibiotics, it's the IC patient. How many of you were given antibiotics and said, even if your cultures were negative, take an antibiotic? Or how many of you have been given long-term antibiotics over time? A ton of you. You know, and what's the toll that that takes on your body? The toll that that takes in disrupting your biome, allowing a fungal infection to persist for long periods of time. Lee says that she likes bladder rest. Awesome. Awesome. So bladder rest is the alternative to Cysto Protect. But guys, oh wait, we didn't do the reveal. Guess what we have now? Speaking of infection, Prevent is finally here. So the same company that made Bladder Builder and Bladder Rest and Peora was asked by the top urologists in the nation to create an alternative to Allura. Allura is used for women who do get recurring bacterial infections. And now, it's possible. You know, again, that's where guessing sucks. There's absolutely a group of people, usually older folks, who do get recurring infections. My sister gets recurring bladder infections, and we now know, a bit immune compromised. And so the question is, what can you do that could help prevent uh, a bacterial infection, especially if you're menopausal and you don't have good defenses from estrogen, et cetera, et cetera? And the answer is a product that contains um, proanthocyanidins, PACs. So Allura has been on the market for a long time. Unfortunately, it's just very, very expensive. So they were asked to create an alternative to Allura that would be half as much expensive. And they did it. It's called Prevent. And super, super, super excited about this. There are already lots and lots of patients, especially the postmenopausal women who really do get recurring bladder and bacterial infections. This is super, super, super exciting. And so this is not a treatment for IC. This is not a treatment for an injured bladder. This is not a treatment for a fungal infection. This is not a treatment for a viral infection. This is designed to help prevent recurring bacterial infections. And that's why it's called Prevent. And isn't that a beautiful label? Man, this company actually rocks with this. So Mem says, what does bladder rest do? Bladder rest has a bladder coating effect from chondroitin combined with an antihistaminic effect from quercetin. And so they're not comparable. They do completely different things. Carmen says, I have Hunter's ulceration and I have a cystoscopy, and you have to have them electrocoagulate them or they laser therapy them. So Carmen, we do have one treatment now. The first treatment in history to heal Hunter's lesions is called Liris, Liris, also known as the lidocaine pretzel. Allergan has it, and unfortunately they've shelved it. And so it's not available now. So we actually had something that healed lesions in 2 weeks, and it's just not available. It would be very interesting, in my opinion, Carmen, based upon the research from Europe about the viruses, it might be interesting to have a next generation viral test to see if you have any virus going on in your bladder. And if that's the case, maybe they can do an antiviral. The same website .org, and that will introduce the company doing it, Microgen, but then you'll have to call the company directly and say you want a viral test, because the low-end test does not normally check for viruses, especially if you had Epstein-Barr. Angie says, I see a lot of people in other support groups who are not able to go to physical therapy because of COVID and they are in pain. Can you stress again the importance of learning from the therapist and continuing at home? Yeah, guys, seriously. The most important part of pelvic floor physical therapy is not the physical therapist. It's not you minutes if you're lucky. The most important part of pelvic floor work is what you do at home in terms of working with those muscles, reducing stress in those muscles. You have to be attentive to the first signs of muscle tension. And when you have them, then normally you would probably be doing some wand work. And let me get the wands. Where is it? Here it is. So the challenge with the pelvic floor is that it's deep inside your body. You can't really reach it from the outside, my friends. The best pelvic floor work is work that is internal. Because if you look at your finger for a moment, you've got 3 knuckles, knuckle, knuckle, knuckle. If you were to insert this finger in your upper vagina or upper rectum, it would feel 3 layers of muscles. A shallow layer around your urethra called the urethral diaphragm, a mid-level group of muscles, and then a deeper level of muscles. And remember, your pelvis is like this. So you got muscles that go from left to right, front to back, low to high. So in my case, My problem is my left piriformis muscle and my levator muscles. So I have to work over on a deep muscle over on my left side. So how do I get there when it starts to get tight? I use a wand, and we sell these on the IC network. The name of the company is IC Relief, and these are called Easy Magic wands. And it's a Pyrex glass wand. And you insert it where you need to insert it, and you work the muscle. And the physical therapist should be teaching you how to use this so that if you get to be in some pain, you can do something about it, because it works. It works. I would just say the limitation here is that, you know, when people say it's your pelvic floor muscles, you're thinking it's the flat muscles, that they're flattened at the bottom of your pelvis. And they're not. Your pelvis, an open box. You've got muscles along the base from your pubis to your tailbone, but you've also got muscles that go up the side like your piriformis muscles. And I will just say that for me, when they first brought this up to me and I tried it, it was freaky. Like, I didn't know. I didn't know. I didn't know how to use it. I didn't know what I was touching. I couldn't visualize what they were asking me to do. It didn't make sense to me. And my physical therapist kept saying, you need a J shape. And they were right. It's a J shape. You start at the base and you go, and you, like a J, you go upward. I didn't get it. I didn't get it until I read this book in January, because he does such a good job of explaining the anatomy and how to work with it, that this is the book that helped me understand the J shape. And so generally when you do physical therapy, and you know, and it still stuns me that there are physical therapists out there who just want to use a wand. They don't use their hands. That's not the way you treat this. You might use a wand if you're incontinent to help you tighten your muscles, biofeedback. But if you've got pelvic floor dysfunction, the odds are you've got tight muscles. And the last thing you want to do is do a wand which teaches you to tighten muscles. What we're trying to do is relax muscles. So what they do is, the best way it's done is with a finger running the length of the muscle. And that's what they will do while you're laying on your back. They're just running the length of the muscle, and they're trying, because a tight muscle is like this. So they're just trying to get them, you know, they will very slowly just try to get the muscle to open up and to get the blood flowing through there. Then they might also work this way to do across the fibers that way, that can also stimulate muscle relaxation. So Angie brings up the perfect point here. Guys, seriously, you cannot be passive aggressive with your pelvic floor work. And hey man, you're preaching to the choir here, because I'm passive aggressive with it. I get it. It's not something you want to do, but it's something you have to do if you start feeling the muscle tension coming on. Linda says, can you take both Peora and Bladder Rest at the same time? Absolutely, but you don't have to buy 2 supplements. Bladder Builder is the equivalent of Bladder Rest and Peora with a couple of other ingredients in it. Intravaginal massage, right? Massage. Meme says, so you said that antibiotics cannot be taken for long periods of time. So how do we get rid of any infection, virus, or what's going on? Well, remember that a virus will not respond to an antibiotic. A virus needs an antiviral, antifungal medicine. Infection needs an antibiotic. Biotic meaning life, meaning small life, antibiotic. So it's just like you don't take an antibiotic for the flu. You can't take, it won't touch a virus. So what you have to do is you need the lab test to see what you've got first. And again, with the next generation testing, the other thing they give you is a list of any drug resistance genes. And then they give you treatment recommendations based upon what they find. You have to understand, they're not, unlike a certain person that I shall not name, they are not equivalent. Viral infections have antiviral therapies. Fungal infections have antifungal therapies. Bacterial infections have antibiotic therapies. It all begins with the testing. No guessing. That's where we get screwed, is when everybody guesses. Hey, maybe. That's what we have to stop doing. We need good, hardcore, detailed testing to know so that we're not guessing anymore. Cindy says, because of COVID, we can't get bladder installation, so you're going to try Bladder Builder. I think that that's a good option. And remember, too, Cindy, they can teach you how to do a home installation as long as you have the supplies. Lee says, I had me when I was 32 and a bladder check 2 years later, I was told I had IC. Well, I'd love to know what they base that on. Did they look at your bladder when they did the hysterectomy, and did they find a lesion, and that's why they said you had Hunter's lesions, or did it happen 3 or 4 months later when, guess what, after the hysterectomy you can't pee normally, and they go, oh well, it's not the hysterectomy, you must have a bladder issue, and they give you IC meds, not explaining to you that the trauma of the hysterectomy and the tension from the hysterectomy in your muscles will make it hard to pee and poop. Seriously, trying to have a bowel movement after a hysterectomy, not fun. Not fun, because you cannot push or strain in any way, because you got stitches in there holding your bits together. Christy says, I went off Elmeron for a few weeks, then back on. How long will it take to work again? You know what, Dr. Parsons answered that. I'm trying to remember what he said. I think if I remember correctly, I think it's like 6 weeks to 2 months, somewhere in there, but I could be wrong. I mean, I will also say that I was working with a patient on Friday whose urologist told her about the Elmeron eye issue and suggested she get off of it. She went to an ophthalmologist. The ophthalmologist looked at her retinas, said it's not a problem, you can stay on it. And we were all just stunned that the ophthalmologist just so casually disregarded it, and the long-term ramifications of using Elmeron, that the longer you take it, the greater the risk. We were stunned that the ophthalmologist was so casual about it, but the urologist wasn't. I will tell you, that was just a local ophthalmologist. The top tier ophthalmologists doing the research on it are deeply, deeply concerned about the long-term effects of Elmeron. So it would be reasonable and prudent, I think, to see if a supplement would give you a similar effect. And that's not me saying that. That's the American Urology Association saying that in step 1 of their treatment guidelines for IC. Brittany says, I feel most of my discomfort after I urinate, especially while walking around. I feel sensations of having to urinate. I feel better once my bladder starts to fill. My urologist thinks I have a tight pelvic floor. Cysto was normal. Do these symptoms? Yeah, girl. Yep. That sounds like pelvic floor. Tyler says, it's been a while since we last spoke. Would love to catch up. I'm at my last wits with pain, going to be scheduling a procedure for a DRG stem. Tyler, call me. Call me this week. Let's talk. Phone number's right on our website, icnetwork.org. Mary Beth, my son has chronic prostatitis. I've had IC for several years. Is this a male form of IC? I feel so bad for him. Okay, so understand, Mary Beth, that when we look at the genetic connections, it's really central sensitization. what we, and it was the University of Maryland that did the early studies suggesting that that genetics could play a role. Now, this was 20 years ago. But now we're subtyping. So now we understand that a little bit more clearly. So there are a couple of things that I would be thinking about. Number one, if you have super sensitive skin and he has super sensitive skin, then that's genetics. So if you have a super sensitive stomach, a super sensitive bladder, a super sensitive bowel, if you have drug sensitivity, food sensitivity, chemical sensitivity, smell sensitivity, visual sensitivity, that's inherited. And that's IC subtype 5 central sensitization. I have this in my family on my mother's side. Generations, 4 generations. And so I was absolutely born with a sensitive bladder. I had frequency urgency when I was a kid. So that's the landscape. Not a disease. It's not a disease. That's a gift of our ancestors. It is what it is. Some of us were born around the equator. Our ancestors had a lot of acid, a lot of fruit in their daily lives. My ancestors were born up by the Arctic Circle, but they had no fruit. They were eating meat, and that's pretty much it, and fat. So the inherited part would be being sensitive, but I'm just going to tell you that injuries happen. And we believe that the vast majority of men with chronic prostatitis are actually pelvic injury patients. And I'm just going to be so bold as to say that in my work with men, in almost every man, 9 out of 10, when we go back in the history, we find pelvic trauma. We find a history of an injury to the pelvic floor, a fall, a car accident. We had somebody earlier. And so I don't think you should be carrying any shame or blame or even feel, injuries happen. When we're born, we're not told we won't ever be hurt. I think it would be very interesting to go back into his years and see if he sustained any traumas. And if he did, to make sure that he had a pelvic floor assessment. I've worked with, I think one really interesting case that I had was a high school, major football player in high school, major football player in high school. And then after high school, like a senior year in high school, all of this appeared and he was diagnosed with chronic prostatitis. And over a period of a couple of years, he became homebound. It was so incredibly severe in him. And so he was like 23 years old, really, really depressed, barely, losing his friendships. And this was one of the popular football players, just life devastated by this onset of this sudden frequency urgency pain. Did all of the prostate meds, nothing worked. Did the IC meds, nothing worked. And, he's an adult living in his mother's house. So his mother wanted to help, but that's a really crazy situation too, because you don't want to listen to your parents when you're 23. At least I didn't. So anyways, mom called me and was just sobbing on the phone. What can I do to help my son? And I said, well, I need to talk to him. And we went over a bunch of stuff and I explained the injury thing. And I said, I want you to ask him if he remembers any bad accidents. And he was a football player. He had to take injury to below the waist. He had to have. Well, that intrigued him, and he actually called me. We had this fantastic conversation. And it's like, all right, dude, so here you go. I want to go back in time here. You're 23 now. It started when you were in high school. Do you remember any really, really bad tackles? Did you really get hurt? And he goes, I can tell you exactly when it started. I went, tell me. He goes, well, we went on a ski trip and I fell off the chairlift and landed right on my tailbone. And that night I had my first symptoms. It's like, hallelujah, baby. Okay. Okay. There's our injury. That's like the person who has some sort of pelvic surgery for something completely unrelated, and they wake up with frequency urgency. They're a surgical injury patient. He fell off the freaking chairlift. Nobody had checked his pelvic floor. And what do you think happened? They checked his pelvic floor. Oh, hell yeah. His muscles were screwed. And I haven't heard from them since. And so I am hoping and praying that the physical therapy helped. I would assume that it has. Generally, people call when they're in crisis. When they're feeling better, they don't call. So do not underestimate the power of injuries to your pelvis. Curtis says, I think it's rad you play online games. I'm young at heart too. I collect, yeah, man. Hey, I love playing games. Perfect day for me is board games with family members and friends, which we can't do now. So enter computer games. Curtis, did you see the rock, paper, scissors streamer contest yesterday done by Mr. Beast on YouTube? It's great. Except Tifu, he's a streamer, linked the code for the game, and they had to shut it down for 15 minutes and restart it, if you know who Tifu is. And Nadeshot, the CEO of 100 Thieves, won. I love watching streamers. They're so hysterical. Meme says, why, when after I went, I have a feeling sensation, I feel pressure to urine to the point that I try to go and I can't, like I'm going to wet myself. Girl, that's muscle. That's muscle. If you're straining to pee, okay, so there are two things. So let me take that back. Let me describe a flare. So ma'am, let me describe a flare. My old flares that I used to have. So you go to bed at 10, you wake up at midnight. And of course, before you've gone to bed, you've peed. So you know your bladder's empty. You fall asleep, you wake up 2 hours later, your bladder feels really, really full. You go to the bathroom, and there's a little volume there, about a quarter cup, you peed out. You go back to bed, you fall asleep. You wake up an hour later, 45 minutes later, your bladder feels very, very full. You go to the bathroom, maybe a tablespoon of urine comes out because it's only an hour later and you haven't drank any water. It's like there's not really water in there or urine in there. So that second time you go, maybe a tablespoon. You push a little bit, nothing comes out. You go back to bed. 30 minutes later, you wake up again. Your bladder feels desperately full. You go to the bathroom, nothing comes out, or you strain and strain and strain, you might be able to get a drop. Okay, that is a quintessential wall irritation flare. That's what happens if you did something during the day that fried your bladder, like had too much coffee or lemonade or something like that. It's that false sense of fullness. You feel full even if it's empty. And so that is a typical flare we see that is a diet-induced flare. So how do we get through that? Well, number one, it's brutal. Because there you are, you're up awake, you feel full, you're really not full, and you want to strain and strain and strain and strain, which of course just makes it that much worse. Because when you strain, you tighten your muscles. So when you have that kind of flare, literally you got to grab your heating pad, drink a big glass of water. We got to dilute your urine to try to wash anything that's in your urine out. So we got to rehydrate your bladder, get some fluid in there. You could do an azo bladder pain relief tablet to try to numb your bladder wall, and you got to ride that flare out. You're going to be up, feeling like you got to pee every 15 minutes. That is going to be until whatever you've taken has calmed the bladder down, diluting your urine, maybe a little bit of Desert Harvest Aloe, bladder builder, rescue installation, whatever. That's what's going to slowly bring you out of that flare. A pelvic floor flare can also give you pressure. So the other thing that we have to look at, and I just had a long talk with a family member about this because she was feeling like she needed to have a bowel movement all the time. And so, or she would have these periods during the day where it's just like, I feel. And so she would go strain and strain and strain and strain to try to get this bowel movement out. And ultimately, it was a little tiny piece of stool. And she did not understand that the more she strained, the worse she's going to make it, because she's just making the muscles tighter and tighter and tighter. And tight muscles also cause that pressure you're describing. So, urination, defecation should be nice and relaxed. You feel a sense of, you feel the urgency to pee or have bowel movement. You go to the bathroom, you go into the bathroom, a muscle relaxes, a sphincter opens, it comes out of you, and you should be done. But if you're feeling that constant pressure, it may be that you're straining, which is triggering that pressure also. Courtney says, I've been battling a bad yeast infection. It has also flared my vulva. Any advice on how to calm it down? Yeah, the thing about Candida, hun, is it feeds. It has to feed. And what it feeds on is sugar and carbs. So it's very, very important when you're having a yeast infection that, your doctor's probably recommending diflucan, something like that. But also make sure you're not feeding it. You got to cut your carbs down, especially your milk sugars down. Milk, dairy, things like that can easily trigger a yeast flare. But also understand that yeast doesn't just burrow into the vagina, it can burrow into your vulva. And so here you're taking everything, but if you've got yeast burrowed into your vulva, YouTube, it's become unstable. Oh wait, that's gone away. If it's become burrowed into your vulva, you might need to use something like nystatin, a cream, on your vulva to kill it in the skin of your vulva. Melissa says, do you qualify for disability with IC? The answer is yeah. Lots of patients with IC have gotten disability, but you have to have a doctor, number one, who will fight for you and explain it. We have a whole disability section on our website. I would encourage you to read. And if you'd like to talk, you're welcome to give us a phone call. It's about the case that's made as well as the quality. Melissa, listen. If your symptoms are so severe, they're interfering with your ability to function and your ability to work, we absolutely have to address it. And there's state disability, which is short-term disability, which you can get for up to a year, as compared to federal disability. The assumption with federal disability is that you will never be able to work again. Well, I don't know about you, but I want to work. And we would like to ideally get your condition so improved that you can work again. And so if you were to call me on the phone, we would talk about the process, but I really would like to understand your subtype, and let's see if we've missed something that could give you relief so that you can work comfortably. Meme says, it's weird. I even push on my bladder from the outside and it feels full, but it is not. Do you have people who deal with this? Do a lot of IC people deal with that? Oh, yeah, definitely. That's classic. All right, guys. Well, listen, we've been going for 2.5 hours here. And I need to finish the rest of my garden today. I need to get back out and garden. For those of you who are on Facebook, if you find this helpful, please give us some stars. I have a very, 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 very small tip. If you have found this helpful, please think about becoming a member of the IC Network or making a donation to the IC Network, because without that, we will not be able to function. If you find this helpful, please try to support this by making purchases through our store, getting our magazine, etc., etc. We normally do a lot of giveaways. I did a big giveaway last week, so I'm not going to do a giveaway this week. What I am going to say, though, is that if you would like our restroom access card or our diet card, little wallet cards, I would be happy to send you a free diet card and restroom access card. All I need you to do is send me your address, and I would just put some in the mail to you. My email address is icnetwork@mac.com. That's short for Macintosh computer, mac.com. Send me your snail mail address, and I will be more than happy to send you our restroom access card and our IC diet card. Julie asks about Hunner's lesions. Hun, we have a whole section on Hunner's lesion therapy right on our website. Go on over to icnetwork.org. Another Julie says, the same Julie, is HPV related to bladder pain? The answer is yes, it can be related to bladder pain. Patients have gotten HPV infections in their urethra and in their bladder. And I would be happy to talk to you about that. Angie said, I told a previous urologist I had my worst pain after I urinated. He said that was impossible. Thanks to you, Jill, I knew better. He's not my urologist anymore, and I have severely tight right pelvic floor muscles. Yeah, baby! I love it. I love it. I love that you are getting better treatment now. Julie has Hunner's lesions, bladder wall thickening, can't walk without pain, can't sit, been diagnosed with HPV, and you had a hysterectomy. Julie, call me this week. I would love to talk to you. If you go over to our website or just the top of our Facebook page, you can see our phone number. It's an 800 phone number. The fact that you cannot walk without pain, that you cannot sit, absolutely points to your pelvic floor. And you might have a pudendal neuralgia, and it literally can all go back to that hysterectomy. It might not be the HPV at all. And I will try to walk you through what those possible scenarios are with you, okay? Do not dare give up, my dear, and do not put it all on the HPV. The HPV might have nothing to do with it. Anytime you cannot walk without pain, that points us right to a mechanical injury, a muscle injury, and that is curable. Curable. Claire says, are you aware that 1,000+ ICers have been to see this doctor in Louisiana who specializes in chronic pain, and they are now cured? Well, I need him to publish his data. He needs to publish his data so that we can all see that. Lisa, it was Bladder Builder. Bladder Builder. You know, Claire, listen, if his success results are that high, there's no reason why he's sharing that with the greater urology community. And we've got lots of providers around the world who make claims, but we have to credibility test those claims, and we need that with a good research study. And if he's got data, even clinical care data, which shows that, man, I'm all for it. I even do an interview with him. I'm more than happy to call him and do an interview with him. Let me just write that down. Maybe I will. But you know me, Claire, what do I say? I don't like blanket statements. I don't like people saying everybody's the same. That is a hot button for me, Jill Osborne. You know, I'll see what I can do to get an interview with him, okay? I'm not against you, hon. You know that. I'm not against the infection theory. I'm very open-minded to chronic infection. I just believe that other things can be involved too. Becky says, you should look into gua sha for your neck and jaw muscles. I've been giving myself gua sha neck and face massage. Hey, Becky, can you email me, icnetwork@mac.com, and tell me more about that? Amanda says, what's a bladder installation? It's where they put a catheter in through your urethra and they pour a bladder treatment or medication into that directly up into your bladder. Yeah, the most popular is a rescue installation, which is usually heparin for a bladder cooling effect combined with lidocaine to numb the bladder wall. It's called a rescue because it rescues you out of a flare. Gigi says, I'm stunned that I stunned the doctor. I was only on it for 6 years and had macular degeneration. Gigi, remember that in that early Elmeron FDA approved, the study that led to the FDA approval, it found eye issues at 4 years. Jean says, I wish you could be more understanding about embedded infections. Nobody wants, girl, I am not against it. I'm not against it. I just do not believe in blanket statements. We cannot deny the fundamental research which keeps over and over and over and over finding fungus. It is undeniable that fungus is playing a role in some patients. Period. And Jean, if you want to tell your story, write it up. Send it to me. We'll put it, we can, if it's good enough, I can put it in our magazine. Claire says, but she doesn't understand the high dose antibiotics. Claire, my senior project for my pharmacology degree was the isolation of drug-resistant infection. I am extremely familiar with this. And pelvic floor is rare? Are you kidding me? Okay, that's just ridiculous. You go back to almost every IC research study, going back to the 1800s, they all describe muscles so tight, they're like tight rubber bands. That, Claire, is ridiculous. I am sorry. Pelvic floor is now considered the number one most popular, not popular, the number one subtype with respect to incidence and prevalence. So that's ridiculous that you would say that pelvic floor is rare. Pelvic floor is found in almost every IC patient that is having a comprehensive, it is a rare patient that does not have some sort of muscle tension going on, if not for the fact that they're hardwired to have tension. Even if they've got Hunner's lesions, which is a viral infection, they're still going to have muscle tension because that's a guarding reflex. That's a central nervous system stimulate muscles to tighten because you're in pain. To say that pelvic, oh my God, girl. Oh, okay. I'm sorry. Okay. We're not talking about it anymore. Guys, I got to sign off. I got to go de-stress. I'm going to go de-stress by planting my squash plants in my garden. So I'm going to say hi to everybody. I will see you again. If you have questions, please don't hesitate to give us a phone call. All right? icnetwork.org. I will see ya. See ya. Pelvic floor is rare. Oh my God. Seriously. That's ridiculous. Thank you, Carmen. That's the type of thing that just makes me crazy. Ah. Okay, guys. Mem says, is that considered a flare? Yeah. Okay, I gotta go. I'll see you guys later. Oh my God.